Angina pectoris is an cardiovascular disease. Look at this picture, shows that normal heart and artery with block. Then ECG findings, look at this. Then echocardiogram findings, detail going on. Introduction. Angina pectoris is a clinical syndrome characterized by chest pain or discomfort due to myocardial ischemia, typically precipitated by physical exertion or emotional stress. It is often a symptom of coronary artery disease, where the heart muscle receives inadequate blood supply. Definition. Angina pectoris refers to the sensation of chest pain or pressure that occurs when the heart muscle does not get enough oxygen rich blood. It is often described as squeezing, pressure, heaviness or tightness in the chest. This pain can also radiate to the shoulders, arm, neck, jaw or back. Types of angina pectoris. 1. Stable angina. Occur predictably with extraction or stress and is relieved by rest or nitroglycerin. 2. Unstable angina. Occur unpredictably at rest or with minimal exertion. It is more severe and may precede a heart attack. 3. Variant angina caused by coronary artery spasm and can occur at rest, usually without atherosclerosis. 4. Microvascular angina, pain due to spasm in the small coronary arteries, often without visible blockages in the major arteries. Causes. The primary cause of angina pectoris is the reduction of blood flow to the myocardium, which is usually due to 1. Atherosclerosis, narrowing or blockage of the coronary arteries due to plaque buildup. 2. Coronary artery spasm, sudden tightening of the muscles within the arteries. 3. Other causes: severe anemia, tachycardia, hypertrophic cardiomyopathy, and aortic stenosis. Risk factors. Modifiable risk factors: 1. Smoking, 2. Hypertension, 3. Hyperlipidemia, 4. Diabetes mellitus, 3. Obesity, 4. Sedentary lifestyle, 5. Stress. Non-modifiable risk factors: 1. Age, increased risk with age, 2. Gender, high risk in men until women reach menopause, 3. Family history of CAD. Complications: 1. Myocardial infarction, heart attack, prolonged ischemia can lead to reversible damage. 2. Heart failure due to chronic ischemia, myocardial infarctions. 3. Arrhythmias, irregular heartbeat due to ischemic damage to heart's electrical system. 4. Sudden cardiac death in severe cases, especially with unstable angina. Pathophysiology. Angina pectoris occur when there is an imbalance between myocardial oxygen supply and demand. The supply can be limited by atherosclerotic bulk, which narrows the coronary arteries, or by spasm of the coronary arteries. When the heart's demand for oxygen increases, such as during physical exertion or stress, the inadequate blood flow leads to ischemic and the resulting pain. Pathophysiology of angina pectoris, step by step. First step: atherosclerotic block formation, lipid accumulation, endothelial injury, inflammation, block formation. 2. Reduced coronary blood flow, stenosis, increased demand versus reduced supply, ischemia. 3. Myocardial oxygen imbalance, increased heart rate, inadequate supply. Lactic acid production. 4. Chest pain, angina, pain, signal transmission, referred pain. 5. Temporary ischemia versus infarction, stable angina, unstable angina. 6. Potential complications: cardiac arrhythmias, myocardial infarction, heart failure. Signs and symptoms: 1. Chest pain or discomfort, often described as pressure, heaviness, squashing, or burning. 2. Radiating pain. The pain may spread to the arm, neck, jaw, back, and stomach. 3. Shortness of breath. nausea and vomiting. 5. Sweating. 6. Fatigue. 7. Dizziness. Diagnosis. 1. Clinical history. Detailed history of symptoms and risk factors. 2. Electrocardiogram, ECG, to detect ischemic changes. 3. Stress testing evaluates the heart's function during physical exertion. 4. Coronary angiography. Visualize the coronary arteries for blockages. 5. Echocardiogram assesses heart function and structure. 6. Blood test to check for cardiac enzymes and other markers of heart health. Nursing diagnosis. 1. Acute pain related to myocardial ischemia. 2. Acute intolerance related to imbalance between oxygen supply and demand. 3. Anxiety related to chest pain and potential outcomes. 4. Ineffective tissue perfusion, cardiac related to reduced chronic blood flow. 5. Risk for decreased cardiac output related to myocardial ischemia. Management. 1. Monitoring continuous ECG, monitoring vital signs and pain assessment. 2. Medication administration, nitroglycerin, antiplatelet agents, example aspirin, beta blockers, calcium channel blockers and statins. 3. Oxygen therapy to improving oxygen supply to the myocardium. 4. Patient education, importance of medication adherence, lifestyle modification and recognizing warnings, signs. Treatment. Medications. 1. Nitrates to relieve chest pain by dilating blood vessels. 2. Antiplatelets or anticoagulants to prevent blood clots. 3. Beta blockers to reduce heart rates and myocardial oxygen demand. 4. Calcium channel blockers to relax blood vessels and improve blood flow. 4. Statins to lower cholesterol levels. Revascularization procedures. 1. Percutaneous coronary intervention, PCI, balloon angioplasty and stent placement. 2. Coronary artery bypass grafting, CABG, surgical creation of a bypass around blocked arteries. Psychosocial medicine. 1. Stress management to anxiety and depression support. 3. Patient patient education, empowering patient with 4. Social support, encouraging family involvement and support groups. 5. Lifestyle counseling, guidance on healthy lifestyle choices. Prevention, lifestyle modification. 1. Smoking cessation. 2. Regular exercise. 3. Healthy diet, lower in saturated fats, high in fruits and vegetables. 4. Weight management. 5. Stress management techniques. Control of risk factors. 1. Regular monitoring and management of blood pressure, cholesterol levels and blood sugar levels. 2. Medication adherence. In conclusion, angina pectoris is a critical indicator of underlying coronary artery diseases requiring prompt recognition, diagnosis and management. Through combination of lifestyle changes, medications and medical procedures, the symptoms can be managed and complications can be prevented. Thank you. Have a wonderful day.